Hi, I'm Dr. Zach Shields with Elite Sport and Spine. Today we're going to look at some movement dysfunctions in kids. This is Quinn and she's going to help me out. Can you wave to the camera, Quinny? Alright, so what we're going to look at today is some issues in kids that can stem from hip as well as knee function. So we can see how Quinny's sitting right here, right? She has both of her knees in, her legs are out. This is causing an extreme amount of internal hip rotation. Now I could never sit like this because my joints are fully developed. But in kids where there's still a lot of cartilage, they can sit in positions like this and it's not good for them, and we're going to show you why. So Quinny, can you go ahead and stand up for me? So what we're going to look for is how that knee goes in when she stands up and the amount of stress that it's going to put on the inside of her knee. Alright, go ahead and sit back down. So as she does that, you can see that she puts that knee in to get down. Now, as girls develop, one of the most common injuries, especially in soccer and basketball players, are non-traumatic knee injuries. So this is something we want to fix now so it doesn't lead to problems later in life. So Quinny, alright, I'm going to scoot you back here. What we want to do is make sure that her knee stays centered over her foot and that it's not moving to the inside. So let's go ahead and put your feet right like this. Alright, so forcing her to stand up this way, go ahead and stand up, is going to activate her quads, but more importantly, her glutes, because the glute is what's going to control that knee going in. It's going to help keep it out here, so we want to work on that glute control. One of the techniques that we use in our clinic to work with kids is dynamic neuromuscular stabilization, which is a fancy way of looking at the way kids develop and making sure that their muscles and joints are functioning properly. So the posters on the wall are some of the positions that we'll put them in for various dysfunctions that we see in their movement to correct those so it doesn't lead to problems later in life.